Afternoon. I mean, it's a pleasure to be here. It's not a pleasure to do the technology. I hate it. And I'm afraid that our lovely participants online can't hear or see us. Participants, I don't know how to know if you can hear or see us, but can you? Raise your hand if you're not here. Okay. Okay, great. So we are going to get started. Thanks for coming to a fluorescent room after dinner. I mean lunch. It's oh, you can see. Okay. It's so fun to talk about things that are near and dear to my heart, and the WISE Latin American Caribbean Network is one of those. So our purpose today is
Hello, Ianina. Hello, Giovanna. Welcome.
Hello, Giovanna.
Ianina, can you turn on your microphone?
Hi.
Ianina,
Yes.
can you speak? All right.
Yes.
Can people in Mountain Laurel hear Ianina? We have a virtual presenter for this session.
No, Janina.
Yeah,
She's
Janina.
with us.
He's with us.
Yes.
Okay, Janina can hear. The voice of God just came out of
Perfect. So, and we also have Giovanna to monitor the audience. Is that correct?
Giovanna and Janina are both presenters in this
Presenters.
session.
Okay. Giovanna, can you turn on your microphone so we can do an audio check?
Sure. I think it's working.
Is it coming in loud and clear for people in the audience there?
Yeah.
All right, fantastic.
Amazing.
Thank you.
We also have around 20 people here joining virtually. So if you can say hello to them, and more people are joining shortly.
We really appreciate the virtual attendees. We're sad that you're not here, but it's special to join by Zoom. Hi.
Fantastic. Thank you so much. Have a fantastic session.
Thank you. So our purpose today is multifold. I mean, we're here to talk about the science, but we're also here to talk about what is like underneath the science and how these things happen. So I will talk a little bit about science, and all of my 7 fellow panelists will talk even more about science. But I wanted to just start by giving a little bit of context to the network that we have. So we will talk about what we've done in Mexico, Argentina, Brazil, Ecuador, Colombia, and beyond. And we will talk about the science and the social programs and the policies that are being impacted by this. But I'll give you like the backstory that you don't find in peer-reviewed papers or even in brochures. So the WISE Latin American Caribbean Network was born in April of last year. We have a mission to enthusiastically join and promote scientific and public policy initiatives that allow for better understanding of experiences with difficulties with water availability, access, use, and reliability in order to accelerate progress towards SDG 6. We do a number of activities, but I think it's nice that one of the things that we've been able to do is bring people together. And this is a special moment in the development of the WISE scales. This meeting that we had there were something like 50 attendees from 13 countries. We had representatives from the government, we had representatives from NGOs, we had representatives from the research sector, and there was a vibe there that just kind of carried us through. And in fact, one of the first products of this network was what we affectionately call a manifesto. That's not what it actually is called. We've done many other papers together, and we can talk about those, but I thought it was just nice to show you that what we did was, and in fact, Hugo really led this. I mean, you give a Guatemalan man an opportunity to write a manifesto, he's going to write a manifesto. So Hugo really led us in this, and this is like a key moment where we all kind of voted to say, like, yes, we think that this is important. We would like to declare that there's real value for experiential measures on food and water insecurity. And this like seed has been growing. So we write papers. We also collect data. I am so grateful to Tere Shama, who is here today. You'll hear from her. But she has really spearheaded the collection of age-wise data in the National Health and Nutrition Surveys in Mexico annually. So we now have 3 years, soon we'll have a 4th. But she's not the only one. So there is a network in Brazil that you'll also hear some more about that are committed to food security. Hugo, what does PENSON stand for?
It's the National Research Network for Food Sovereignty, Food Security, and Nutrition.
Great. And they realized a couple of years ago that food is important, and that which underpins food is water. So you'll hear more about the work that they've been doing to collect. This is now in 16,000 households, nationally representative in Brazil. It's going to have some real impact on how the Brazilian government does what they do. You can also talk to Pablo, who's up here, about some of the work that he has sort of fostered in a particular state in Mexico, Nuevo León, where we kind of partnered, the government asked us to come to explain how we do what we do with the Y skills, and then now have rolled that out in their, what does the Czech survey stand for?
Módulo Estudios Socioeconómicos, like socioeconomic model survey, something like that.
And you can read about that in this impact report. So we have 2 reports up here. One is the one with the white on the bottom, is kind of summarizing what we've done for the last 10 years and some of the impacts that we've seen. And this is a page from that explaining how governments are using WISE data to better understand community needs and target poverty reduction efforts. The impact report. We do other things too. We write fantastic newsletters. And the newsletters are a way of keeping people apprised. We will, we had this fun dinner last night that we publicized through this newsletter. It's a great way for people to know about what's happening in these days of like Twitter weirdness, where who knows what we see on that. In these days of like, oh, you're doing this, like and it's really fostering this exchange of knowledge about what's happening in Colombia, can inform what's happening in, say, Ecuador. We also have great swag. I think that's a really important hallmark of any network. So these are frames that we've seen around in different people's offices. So everyone who came to that meeting in April got this Talavera tile. And there's other swag, which is some of you have and some of you don't. Please, I beg of you, this is a new manual. It's just new, fresh. It's hot off the press. I got it from the printers on Friday. It's also available digitally, and thanks to colleagues at Charity Water and other places, we will have a Portuguese version, a French version, and a Spanish version. We're taking requests for other languages. I can't say I will fulfill all of those dreams immediately, but it's really important that we aren't, English-centric. And we also have lots of fun. So, fortunately, unfortunately for Josh, I had a really good video of him dancing at a party that we had in Mexico. There were others of us on the front row dancing as well. Some of us are better dancers. Hugo was one of them. Some of us being better dancers than others. You don't get to see the action shots, but you do get to see that we, the family who plays together stays together, and we do good things together. Oh yeah. Oh. I'm afraid it'll break the tape. Technology triumphed. That's a little bit of the context of what we're doing, but it's now, it's important to hear with the science that we're doing as well. And this is the cast of characters who you'll be hearing from today, technology willing. But as I was preparing for the session, I read that I would also talk to you about some scientific findings. So I'll give you a one slide on some of the stuff that we've been learning. So this is from a forthcoming FAO report. And I think it's really telling and important to notice that it's FAO who's asking for these water data. So the water data themselves were collected by Gallup World Poll, who does nationally representative sampling for pretty much every country to track progress towards the SDG of pertaining to food insecurity. And what we have here is in those same people who had food insecurity measured, we also measured water insecurity. So this map is now out of date because we're continuing to collect more and more data. If it's a country color, then that means that we have nationally representative data for that country. If there's a blue dot, that means that's a place where site data has been collected. So what we could do is we could look at the relationship between food and water insecurity. And so what this is saying is that these are the odds of being food insecure, moderately to severely food insecure, if you are moderately to severely water insecure. So for those of you who know the scale, the range is 0 to 36. So if you're scoring 12 or higher on the water insecurity scale, you are somewhere between 2 and 3, sometimes even more times, likely to be food insecure. And this is the unadjusted and adjusted, so unadjusted in green, adjusted in black values, which means that we're controlling for all the things that we generally think of that shape food insecurity: age, gender, income, urbanicity, and so on and so forth. So this, I use the term gateway drug maybe a little too loosely, but I really appreciate that water insecurity is a gateway drug to get other people who aren't necessarily caring about water to care about water because they care about food security. So with that, I'm going to turn it over. I'm very scared for switching slides. I'm going to turn it over to the next speaker, who I believe is Josh. No, who's second? Third? Oh, I can see it. I can't see what's up there, but I can see what's. Oh, it's Tere. Tere Shama. Yeah, here we go. Oh, this is so scary.
Drag it.
Oh,
I was just open another session.
I'm sorry.
¿Cómo pasan los slides? ¿Cómo pasan los slides?
Yes, so it goes over there.
Oh, no, that's fine.
So maybe if you can just drag this whole
We have to pin. He said you have to pin the presentation. Whatever that means. You have to pin the presentation.
If I stop share and then maybe just share.
this one. Yeah. That's why I just go maybe just try dragging them over to yours.
Okay, I'm very happy.
Don't go.
This, right? Something happens.
You want it to be like this?
Oh, like
Maybe just try dragging the whole thing over to the right, like to that side.
like the whole thing.
Yeah, like the entire presentation.
How do you do that?
I'll press this one. Or like. Like that.
Hey,
That's not good.
there we go.
5 to go.
It's just like an example online.
So, good afternoon, everyone. Buenas tardes from Mexico. And first of all, I would like to thank Sarah Young for her invitation to this session. Today I'm going to share with you the experiences of water insecurity in Mexican households, use of the age-wise scale in the National Health and Nutrition Survey in Mexico and SANET. As you know, the right to water is universal. More than half of the world's population experiences severe freshwater scarcity for at least 1 month of each year. There is an increase in the population experiencing problems with insufficient, excessive, and/or contaminated water. Water insecurity in households is defined as the inability to access and benefit from adequate, reliable, and safe water for well-being and healthy life. A brief of Ensalud in Mexico is that it's a part of the National Health Survey system in Mexico, and in the years 1988 and 1999, national nutrition surveys were conducted, and in the 1986 and the 2000 national health surveys were carried out. Starting in 2006, the health and nutrition component was consolidated, marking the beginning of Ensalud. Since then, 8 surveys have been conducted, and from 2020 and on, the Ensalud is continued every year. The survey shares a similar design, which allows to understand the health and nutrition status of the Mexican population as well as the state response. The measurement of water insecurity was first included at the Ensalud at 2021. Previously, water security was measured mainly through indicators related to infrastructure and availability. Other dimensions such as access, use, and reliability, which are associated with other aspects of well-being, like food security, were not included. To measure this other dimension of water security, a scale was developed focusing on household water insecurity experiences. This scale is a validated tool in various middle and low-income countries, including some regions of Mexico. But in Mexico, there was not national level information of these dimensions of household water insecurity, as I was mentioned, until 2021. We worked sessions to review and adapt the age-wise scale in Spanish. First, a age-wise practice was carried out on 20 people to understand the questions. Then the first version of the scale was piloted in 200 homes in 30 states of the Mexican Republic. After that, with the piloting, the wording of items 4, 9, and 12 was modified. And finally, the feasibility of the household water insecurity experience scale was identified and adapted into the Mexican context. Some of the results of water insecurity from the years 2020 to 2023 are that 1 out of 6 households in Mexico experienced water insecurity without differences between urban and rural areas. And in this slide, I want to emphasize that the prevalence of water insecurity was in the poorest states of the country, that are as Guerrero and Oaxaca, that you see in this slide in red. And some characteristics of the household with water insecurity are that 1 out of 5 the head speaking an indigenous language lives in lower tertile of well-being conditions, have children under 5 years old, and I highlighting that lives with moderate and severe food insecurity in the 30 to of the household. And the frequently and always any of experiences of water insecurity, 12% of the household lives feel that the water not recommended, and 6% are anger. Finally, some recommendations are to incorporate in the government's agenda interventions to solve water insecurity and to use in the evaluation and monitor of health and nutrition programs and some surveys scale such as the age-wise. I want to thanks to the collaborators to this research, and thank you very much.
We have some time for questions after each session, so while you think of yours, I would like to ask today how these data have been received in Mexico. I mean, who's listening to these data and what are they saying?
So, in Mexico, the Salud is the way to have data to the government, to the health minister. So, they look that the water insecurity is a big problem, but we have now a change of government. So now we don't know how they feel, but we are working together with the scale of food security and water insecurity, and we hope that the government and the Minister of Health going to focus in programs and policies. We are working now. Our government only have 14 days, the new government. So,
and water was a big campaign issue, it seemed.
yeah. We don't have a big campaigns now, but I hope with the Salud, the continuous Salud in this year, in 2024, we are now at the field work. We are going to have data from state levels. So I hope that the governments of the state make campaigns or some actions to solve this problem. But it's a big problem. We have a scarcity of water insecurity in a lot of states of the country. So,
no. Are there questions?
I had a question. Was any of the results you found surprising to you?
No. we didn't have the data. Doesn't surprising because in Nuevo León they have problems with security, with water, hot water. And we applied the scale, we have the same results. So it's that we hope.
Thank you. I was wondering if you had looked at the different components of the scales to see which were more driving the insecurity in the areas where you found it, worry or washing.
Yeah, I think that this scale have a lot of components. There are some components that the people feel not well. So in some areas, as rural areas, they feel not well, but we are working and training to our team, and now we have more experience. The first one was very, very hard, but now it's okay.
¿Hay algún ítem que se relacione más con inseguridad alimentaria o no se ha explorado?
With the food security, I think that the availability of water had a direct relationship with food security and water security.
Please.
So I have a question on a slide in the map showing this water insecurity of different areas.
I'm sorry, I don't listen to you.
Slide of
Ah, yes.
So while looking this map, what I realized is, there is a, high water insecurity in lower belt. So is there a specific characteristic of that area, like a situation of access to water is different from this red to green? So it's like a, in bottom part.
Yes, the northern of the country are the rich of the country, are the states that have more well conditions. So in the south, this is Oaxaca and Guerrero are the poorest of the country. They don't have access to food security and don't have access to water security. And they have a highest rural and indigenous population.
Please.
So I want to find out, are you doing any kind of advocacy with this data to kind of look for changes and improvements of the situation? Or what are the low-hanging fruits that can be dealt with immediately?
I'm sorry, but I don't listen to you. Sorry.
Okay, so
algún tipo de abogacía.
He listened to you. Sorry, I don't listen well.
yeah, and seeing as you mentioned that you just had a change of government, what are the low-hanging fruits that will be affected by the political changes?
Yes, it's a good question. First, we need to know the situation. So with this data, we can make advocacy and propose some policies. But now we are in the phase that we are knowing the situation in Mexico, and we need to talk with the authorities. And now is that.
We'll take one more question and stop in tense. Yes, please. Hi.
By the way, when we conduct this HY survey, do we consider, because it's in the household, so do we consider male, female separately asking the same question, or is just one representative from one household?
So you signed yourself up for a free manual. Because in this, we have, yes. So there's a household version of this scale, which is what Terry is talking about, and there's also an individual level version.
In internet, we interview the responsibility of the who makes the food at the household.
The head of household.
The head of household.
In charge of the food.
Yes.
Yeah, because sometimes within the same household, there can be a big variation, sometimes not. And there's an FAQ in that.
From 20 to 23, we have information in about 40,000 households in Mexico.
That's fantastic. I saw Tom's hand raised. I'm going to try to switch slides, and while Tom maybe asks the question.
Thanks for a nice presentation. My understanding is that one of the unique things about your data set is you have data since 2020 through 2023. So I wondered if you could say anything about the changes over time.
Yeah. At least we don't have changes by year at this moment. Only 1%, but the design of the survey of Ethanoth is continuous. So in 5 years, we have the representative survey at all levels: national, rural, urban, and regions, and now to states. So we don't have changes only from 2020 to 21, but in 2020 we don't have information about the water insecurity. Food insecurity, yes, but water insecurity, no. And all the information is at the page of Ensanut. You can find this at ensanut.com, and you have access to the database. It's not only for water insecurity, all Ensanut.
Let's appreciate Dr. Carmel.
No, thank you.
Joshua Miller, very local, UNC. Step right up.
Thank you. I'll keep the Ensanut party going by talking about some findings from the 2021 survey. So, as Terry was saying, there is a lot of really rich data. It's publicly available also, letting people know a lot of the Ensanut data are a really rich data set, and it's really great that water insecurity is now included in it, so that me and some other researchers in collaboration with folks at the INSP can be analyzing them to address some big questions we have about the relationships between water and diet. So, as I think has been made clear, water insecurity or water security creates a rich environment where people have the potential to have really good health and diets. So water is critical for a lot of food behaviors and health behaviors, including direct consumption, but also food preparation, food production in smallholder farming communities, and also other income generating activities so that people then have the cash or finances to go and then purchase foods. So in theory, this is from a review paper a few years ago, where we would think that all of these in turn would then lead to better health and well-being and better nutritional indicators. So filling in those boxes of maybe we could think of the mediating pathway of something like diet healthfulness or diet quality and leading to NCDs. I can never say that word well. But yeah, I feel like a lot of the WASH realm has focused a lot on infectious disease and diarrheal risk and other things that are, of course, very highly important, but it's also possible that water issues are contributing to the dual burden of disease where people are experiencing both over and under nutrition. So the Ensanut data provided a really nice example and potential to explore that. So let's see, okay, animation. And I think this is really helpful because in one setting where we have had data from water insecurity before, there were 4 countries throughout sub-Saharan Africa where we had repeated cross-sectional surveys, and we were able to show for the first time that water insecurity was associated with lower odds of consuming all of these foods. So lower likelihood of consuming grains, pulses like lentils and other things that are all part of a good diet, nuts, dairy, meat, eggs, all much lower odds. So indicating that water insecurity, even when adjusting for all the things that we would expect, like wealth, urbanicity, is still seeming to be strongly associated, indicating that maybe water insecurity is a really key part of diet. But this was in a very different context where overweight and obesity are not common. So again, this is why I think the Ensanut data are really interesting, because it's in this transitional state where people are having both over and under nutrition. So we got to explore those, and what I'm presenting today are medium preliminary results. Kind of have been shopped around a little bit, others not so much, but to get to the point of it, so of course water insecurity measured in the prior month using the HY scale, food insecurity in the prior month using a tool that's also been developed and validated for that region, dietary intake using a food frequency questionnaire, which means we basically asked people, what did you consume in the past 7 days, rough amounts that they were consuming of each of those foods. And we used those to create some global dietary indicators, so things you can largely think of NCD Protect as this group of foods that you should consume to lower your risk of cardiovascular disease, overweight, obesity, and then some foods that people suggest not eating. This is, again, a standardized global indicator, and then looking at self-reported disease. So this is looking at people who were experiencing the concurrence of both food insecurity and water insecurity compared to people that weren't experiencing both of those, and you can start to see some changes in these diet groups. So it looks like people who are experiencing high water insecurity, this is the red one, are less likely to consume some foods that we know to be helpful and beneficial, like vitamin A-rich fruits and other fruits that are part of a good diet. And also more likely to consume something like red meat. Pathways to be determined, but the preliminary results are suggesting dietary pattern differences by food and water insecurity. And putting it all into a big model where NCD Protect is a continuous score. You want a higher score to mean that you're doing better. We split this by men and women because, as people were talking about, there's likely could be potentially gendered differences in how water insecurity impacts how people experience or consume diets. So we were finding that among men, higher water insecurity was associated with lower NCD Protect scores, so less likely to be consuming a healthier diet, and no association with women, but food insecurity there was. And then now going to wrap this up with, again, this is just a brief overview of a lot of the really rich data that we're able to use with these data. And this is coming from Kayla. I saw you walk in. Hey, everybody, look, Kayla. Kayla is leading this analysis. Again, the Wise family is quite large, so I'm presenting these on behalf of her. But some early data are showing that there's also strong associations with health outcomes, so self-reported health outcomes. Again, as Terry was saying, there's not just diet data, but there's also health data. So higher relative prevalence among people who had water insecurity relative to those who did not, higher prevalence of diabetes, hypertension, obesity, these diseases that we know are increasingly common throughout the world. So this is some of the first data to show that.
Just a clarifying question, Kayla or Josh, is this controlling for food insecurity?
This is controlling for all these things on the bottom, including age, sex, socioeconomic status, education, ethnicity, piped water access, urbanicity, and region. Not controlling for food insecurity because it could be a mediator. So food insecurity could be so you would attenuate the effect of that, but it's worth adjusting potentially to see if there's other pathways beyond its relationship with water insecurity that it could affect. So, good question. Quick summary for my very brief presentation is water insecurity it's becoming evident as we have this accumulating knowledge as a key determinant of health, and that doesn't take convincing to this audience, but I think what's really interesting is that food and water insecurity are co-occurring very frequently and impacting health through different pathways and sometimes acting in a synergistic way to increase the likelihood of poor health. So that's all I have to say, and just a lot of thanks to the collaborators and in-country people who are collecting these really great data.
Not to pick on NCD, but I mean it's so special that these data are now being collected within the context of a larger national health and nutrition survey, because we get to see these kind of things that you can never see from a Gallup type poll. So my comment is, this is special. This is so different from any other data that I know of that exists. What is the next sexy thing to look at in NCD data with water? I mean,
yeah.
I know you have lots of analytic ideas. You don't have to give us all of them, but I mean, there's a room full of people, and there are lots of people online thinking oh, maybe I'll look at that. What would you recommend?
So there's a handful of things. As Sarah said, I can always come up with ideas, but execution's hard. One of them is I didn't leverage the diet data as much as I could have. I put them into pretty simple categories of whether people ate these foods 15 grams more per day or whatever. What's really interesting is we can start to look at dietary patterns and look at what combinations or ways that people are eating and seeing if those are different. So that's one thing. Leveraging the longitudinal nature of these data. Did not do that because when I started these analyses many years ago, it was just the one round of data. Fast forward, now we have a lot more. And of course, I think what Terry was doing would also be interesting here is looking at which groups are the most impacted with, particularly I think the co-occurrence of food and water insecurity, because we know that together those people are much higher risk of diseases that are of clear public health importance. So
yeah,
those are just a smattering of tons and tons of data. There's also biomarker data, there's other health data that are available beyond just the self-reported data too. So.
Are there questions from the crowd for Josh? Please don't go away until we switch the slides. Oh.
Just more for conversation, but so these are cross-sectional data, right? And
Yeah.
obviously, chronic diseases typically take many, many years to develop. So
Yeah.
one of the things I was kind of thinking about as you were presenting is the time and labor burden that water insecurity presents to families and how that might be impacted if someone in the family has a chronic disease, right?
Yeah.
Because that probably means that they're less able to do things like walk an extended distance to get water to bring back to the family. So I just wondered what your thoughts were about that and sort of trying to think through the causality of these questions, both given the life course nature of the problem, but also the cross-sectional data.
Yeah, so this is, again, this would be a great question for a lot of like longitudinal cohorts that are doing this, of looking at this aspect, because we know that there is I'm just doing
Hi, Sarah and colleagues. The audio is off just in case, and I cannot see my presentation on the screen. So if you could help me with that, please.
Giovanna?
Yeah, now it's working. I can hear you. Great. I just cannot see my presentation on the screen.
Oh, well, let's see if we can change that for you.
I mean, I can open it from my own desktop, but yeah, I'm gonna tell you when to change the slide. Oh, there you go.
Lovely.
Great. Now it's working. Okay, good afternoon, everyone. Thank you, Sarah, for this invitation to share the current state of chronic childhood malnutrition in Ecuador. It's linked to water insecurity and how the application of the household water insecurity experiences, the H-WISE scale, can support this analysis. In the next slide, here are the topics we are going to cover in this session, starting with the stunting in Ecuador, the national survey on stunting, the ENDI, the water quality testing, followed by some conclusions. And after this session, we'll share the results of the H-WISE scale application in Ecuador with our colleagues from Green Empowerment. So in the next slide, we can see that Ecuador is not changing.
Yes. Okay, we'll be there in a moment. One moment, Giovanna. This is her, right? No. Giovanna, second one there. Okay, is that good? Giovanna, can we hear you still? Can you hear
Yeah,
us?
yeah, I can hear you well.
Great.
So I was saying in the next slide, how it works. There you go. So Ecuador is the second country with the highest stunting rate amongst middle-income countries in Latin America. And this affects 17.5% of children, meaning 1 in 5 children suffers from stunting. A child with stunting not only experiences delayed growth, but may also face cognitive and learning problems, risk of overweight or obesity, a higher risk of having non-transmissible diseases such as hypertension or diabetes in adulthood, and difficulties integrating into the labor market. The next one, please. While the prevalence of stunting, as you can see in children under 5, has decreased since 2006, recent records show that since 2022, these rates haven't changed in Ecuador, with higher prevalence in rural areas at 21% compared to urban areas at 15%. Among ethnic groups, indigenous children have the highest stunting rates at 34.5%. Stunting is a multifactorial public health problem associated with numerous determinants. Organizations such as WHO, the World Bank, the academia, and UNICEF have proposed several analytical frameworks to understand child malnutrition, and specifically stunting. These frameworks share the common understanding that adequate diets, access to safe water, health and sanitation services, and social practices all contribute to stunting. The conceptual framework that you can see in the slide developed by UNICEF outlines the immediate, underlying, and enabling determinant of stunting, and is a valuable tool for analyzing the causes behind the country stunting rates. Ensuring proper maternal and child nutrition requires adequate diet and care, and these in turn rely on other factors. Among the underlying determinants of malnutrition is food, which include breastfeeding, as you can see, and access to adequate food and safe water. Proper feeding includes hygiene and food preparation practices. And finally, environmental determinants include access to adequate sanitation services. To secure sufficient food, feeding practices, and clean environments, resources and positive social and cultural norms are crucial. And of course, governance systems form the foundation of the whole model. The next one, please. So since 2022, UNICEF and other organizations have supported the National Institute of Statistics and Censuses, INEC, in conducting the National Survey on Stunting, the ENDI. This to assess the nutritional status of children under 5 years old in Ecuador. This survey uses international standards to conduct anthropometric measurements, blood tests, prenatal care, vaccination scheme, breastfeeding practices, water quality tests, among other topics related to stunting. The survey covered over 22,000 households across rural and urban areas in 23 provinces in Ecuador. And as part of the water quality analysis, the JMP, the Ministry of Health, and UNICEF provided training for testing residual chlorine and E. coli in water sample taken from the main source and the point of consumption in the household. If children consume contaminated water, they may develop diarrhea or parasitic infections, which impede nutrient absorption. And recurrent diarrhea during the child's first 1,000 days can lead to chronic malnutrition. In the next slide, you can see that regarding the residual chlorine, results in round 1, that was from 2022 to 2023 survey, 73% of the households had no chlorine at the source, and 83 had no chlorine at the point of water consumption. And these values decreased slightly in the second round from 2023 to 2024, and the most affected regions were the Amazon and the coast. In the next slide, you can see that regarding E. coli, while its presence at the source decreased in round 2, it increased at the point of consumption at 30.5% due to poor household practices. In round number 2, 26.7% of bottled water, 74.8% of spring water, 66.9% of well water, and even 23.7% of public neighborhood water tested positive for E. coli. And again, the Amazon region had the most contaminated water compared to the coasts and the highlands. With the efforts made to test water in the Andes, we now have a clear understanding of water quality consumed by children under 5. However, as part of our WASH program at UNICEF Ecuador, particularly in community water system in rural areas with indigenous children, we sought to gain deeper insights into the availability, accessibility, use, acceptability, and reliability of the water system. Additionally, we aim to better understand the sanitation and hygiene practices within the households. And to support this, we incorporated the age-wise scale into our interventions. And we think that the findings from this scale not only provide valuable insight into water insecurity, but also help us identify areas where our WASH interventions can be tailored to better address the specific needs of the most vulnerable children and their communities. These results will be shared in the next session by our colleague Sam from Green Empowerment, one of our implementing partners. And just to conclude this part, I would like to share some conclusion in the next slide. And it's that, of course, stunting remains a critical issue in Ecuador, as you could see, especially among indigenous children, rural and the Amazon region. And of course, water quality is closely linked to child health and stunting. And that's why we need to improve the WASH services. This is essential to reduce stunting. And finally, well, poor household hygiene practices at the point of water consumption exacerbate contamination. And as we know, the ND helped us measure water quality, but we think that with the age-wise scale, we can expand this information by providing this valuable data on the water insecurity area. And finally, we do believe a stronger governance and multi-sector collaboration are vital for addressing stunting in Ecuador. And we need to coordinate efforts with the health, water, sanitation, education, and nutrition sectors. And with this, I will finish my presentation and Sam can talk a little bit more about the results. Thank you so much for your attention.
Are there questions for Giovanna before Sam starts? Okay, maybe we can wrap yours in.
Works well for me.
You're doing a great job with technology. I want you to know that. You're knowledgeable about many things. It's like, I don't think me coming over there would help anything.
Cambio climático.
Very good.
So you can see if you can see that online.
Pero Guatemala lo duplica, pero...
Tiene 17%.
Sí.
México tenemos 13%.
Okay, we should be good to go. Good afternoon, everyone. Thank you so much for the welcome. Sam Schlesinger. I'm accompanied today not only by our colleagues at UNICEF, but also by Gwen Lee, who is stepped to the back, taking photos for us. Thanks so much, Gwen. So a little bit of background on Ecuador as sort of representative of the sector in Latin America. It's a country with a relatively small population versus the rest of the region, about a world population of 6.3 million, and of that, 2/3 of the population, 4.2 million, has piped water access at their home. However, those 4.2 million people are served by over 7,000 water systems. So if you do the math, it's an average about 600 people per system. Not service points, 600 people. So monitoring the quality of those services, very distributed, very difficult, and while data from stuff like the ND is fantastic, it may be cost or logistics prohibitive to really do that at a national scale. At the same time, we're an organization that supports small implementers looking to close that gap, those 2 million people that currently do not have access, and we're very interested in how you might build a monitor the changes in service quality that are really affecting people's day-to-day lives. So our efforts were to look a little bit at how feasible is it to integrate the HWISE-12, working at the household scale again, not the individual, and even the HWISE-4, really trying to be as efficient as possible with time for these implementing partners who are working in rural communities in these small systems. And at the same time, can we learn? Can we really improve the implementation of the programmatic experience based on the data that's coming in from the HWISE? Work for a small nonprofit based in the US called Green Empowerment. We support a network of implementing partners across Ecuador, areas with a lot of ethnic, a lot of environmental, a lot of linguistic diversity. Maybe not so much environmental diversity in the fact that all of these places are quite water rich compared to many areas of the globe. However, ethnic and linguistic diversity, we're trying to get to people in their primary language when we were doing the HWISE. Didn't always manage it. Some enumerators were not always available for some of the indigenous languages, but really attempting to use primary language. Our methodology is to first standardize a survey across implementing partners, implement this mix of the HWISE-4 and the HWISE-12, depending on whether UNICEF was collaborating or not, depending on how much time we had per household, and then really roll this out across communities, some of which where we only have baseline data to date. Again, we're sort of presenting this mid-process. Some of which where we do have closeout data. And then in a placebo community, we're going to see where the intervention didn't actually improve the tangible service for users in the community. Sort of see what impact might we see on HWISE scores just based on the presence of an actor. First, comparing a little bit the HWISE-4 and the HWISE-12 data. That's shortening the HWISE-4. We're losing a little bit of the richness of the data perhaps, but we are seeing a lot of coherence between the data sets. I apologize that this screen is blocking some of what we're meaning to be seen here. Let's see if we can drag that out of our way.
You can minimize the...
Minimize the...
Yeah, let's see about that.
There. Yes.
There we go. Right in the way of what I'm trying to show. Which is that one of these indigenous communities, the Chapala speakers of the coast, we didn't see that same coherence between responses that we would expect. There may be a linguistic issue there in Chapala. It may be something about the shared water access practices of these people living along this large surface water source. We're going to continue investigating it. We have a lot more work to do with the Chapala speaking communities. And here, the overall water insecurity scores among communities that have been surveyed so far. Again, these are very small communities, ranging from 20 up to about 200 households, service points. Different mix of primary water source, so some with water systems, which are these orange bars you see, some with surface water. And you can see the cutoff line. For the HWISE-4, a score over 4 is considered water insecure. So, looking at these communities, I'd like to call your attention to two things. One, that we do have communities dependent on surface water, dependent on rainwater sources, that actually feel less water insecure than some communities with pipe water sources. So pipe water not necessarily providing all the benefits we would expect it to. And the second are these very wide variations in HWISE-4 scores for some of these communities with pipe water systems. Maybe some of these houses are on top of hills and they don't have water pressure all day. These are neighborhoods that don't get service every day, but very wide variations. These two bars, or these two charts are broken up. Those communities on the right are the ones we're collaborating with UNICEF Ecuador on, so we expect to have end-line data in all of those quite soon. And the ones on the left are the communities we worked in previously in other regions of the country. So in the limited communities where we do have pre and post data, of course we're very excited about these drops in water insecurity, right? That's acting as we would expect it to. But this placebo community, Espino Sur, where this was just solarization of their supply, reduces the cost of operating the system, but doesn't provide a tangible benefit to any of the people receiving the service. No one's getting their water cheaper there. Yet, we still saw this statistically significant reduction in water insecurity scores. It was already low, dropped even further. Maybe that's a little bit of surveyor-induced bias. In many of these cases, the enumerators have been intimately involved in the project, so people may be giving them the response they think they're expected to give about the water service improving. But there may also be some sort of inherent improvement or perceived improvement just by the presence of an actor working on the water system in the community. So we think that may be an avenue for further investigation. And looking again at maybe what are some of these factors associated with water insecurity in these communities in Ecuador. Thinking about this more than anything else as a way to guide our implementation experience. What aspects of service should we really be focusing on improving to see all of these psychosocial benefits that we know the HWAS is indicating. One is really the distance traveled. You all may know the definition of sort of basic service levels is a 30-minute walk round trip to gather water. Here, at least in Ecuador, we're seeing a much lower barrier, right? More than 25 meters, more than a 5-minute walk, already starting to increase water insecurity scores. Again, these are water-rich areas. If you're gathering as many buckets as Lorena here has, those 5 minutes trips start to add up in the course of your day. And the other place where we saw a lot of association, I apologize that this is continuously in the way, is the perception of water safety, or the use of a secondary water source because primary water sources are perceived to be unsafe or not always available. So perceived water safety, another big indicator of water insecurity, or a lot of correlation with water insecurity, much more so than self-reported water treatment, much more so than this sort of very baseline subsphere indicator of 10 liters per person per day. So really seeing that that's a big indicator, and another place where we're really seeing indicators are water uptime, as you may not be surprised to see. If you have to have outages in your system, keeping them predictable is a big thing that's improving people's experiences with their water service. Unsurprising. And also having water available, the language here got switched up a little bit, but having water available every day, even if it's for a limited number of hours, is a big improvement versus entire days spent without water. So places where these are just data coming out of communities that do have pipe water access. So again, thinking about when we are working with implementers, when we are working with operators at the community scale, how can we really shape service levels to best meet what people expect out of these services? Again, these much more indicative than whether people are satisfied overall with the water service or the amount of water they're consuming where water systems are metered. Overall, we saw the use of the HWAS-4 and the HWAS-12 to be very feasible, fairly plug and play with brief training, even if that was virtual training. Most implementing organizations were really able to get high quality data going out in the field. However, it was not always the most comfortable experience for the enumerators. As you ask some of these questions, they are experiential, they are emotional. You can sort of see the gears turning in people's heads as you ask some of these questions. So some of our enumerators out there looking to get things done, lickety split, felt that to be a little uncomfortable. So thinking about, are we getting more richness of data out of the HWAS-12, and is it worth that moment of discomfort for implementers? But we did see a lot of quality of the data. We're excited to continue analyzing it. And we really do see the HWAS-4, the HWAS-12 as being wonderful complements to this more JMP level data, or to data like the ND that is very granular, but is very demanding in terms of the amount of infrastructure and the amount of institutional buy-in needed to gather that data. So excited to see the HWAS rolled out further. We hope we can use the experience of Mexico to twist arms and get public policy to change within Ecuador. We appreciate all of y'all's time today.
While you prepare your questions for Sam, I would like to point out the beautiful page 20 in the manual, in which you will see a spider diagram showing the before and after of some data in Nepal, but what you can see is how each of the items change or don't change, and that's proven to be quite informative. Let me not put words into Scott's mouth, but that has proven to be informative for some of the work that Helvetas and Charity Water are doing. Because you see what is making an impact, you see what doesn't change too, which is sometimes even more important. Questions, please. In the back.
Thank you guys both for your presentations. I was curious about your thoughts on how HWAS, I guess this kind of goes for everyone's presentation so far, but that HWAS, the surveys do tend to be really labor intensive and take a lot of time and capital to roll out. So with support from the government, that can be really important. But if you guys see any other alternate or additional routes for data collection that might like streamline and be able to supplement without maybe as much labor involved.
So yeah, surveys are expensive and every minute counts. So the HY scale takes approximately 3 minutes when you ask 12 items. And the 4-item version, so the abbreviated version, is a subset of those 12 that takes roughly 1 minute. We're also looking into dichotomizing the responses. So you know, everyone wants less time on surveys to be taken up. So we're exploring that right now. There's an FAQ in the manual about it. And that takes about 2 minutes. And there are pros, there's no right or wrong age-wise or I-wise or a 12-month recall versus a 1-month recall. It just depends on the purpose. Now, the modality, we have a lot of success with telephone surveys and with face-to-face interviews. But right now, there's some work being piloted in with what's the word, tablets of like college kids doing this in Mexico with tablets. Are there other modalities of which anyone else is aware? There have also been cell phone surveys. So a company like piloted this in Brazil, and just there are these mechanisms where you can get some money towards your cell phone bill. Like if you take the survey, I don't know if that's not data I want to hang my head on, but it does show the feasibility of telephone surveys.
And then one follow-up question. How do you guys like intentionally or adequately like target to make sure like if you do these surveys that you're targeting and reaching all kinds of demographics and vulnerable populations that might not maybe have cell phone service access or in particularly rural areas to make sure you're getting proper data to people?
So again, it depends on the purpose of the reason why you're collecting the data. Sometimes it doesn't matter if people don't have cell phones because you can do face to face. Does anyone want? I've been doing a lot of this speaking.
I mean, I think it might be interesting to know how sample size design was done for the Insanul. I imagine that's a fairly well-developed methodology in order to design what the survey size is for this. In the case of these small communities, we're covering everyone.
Okay.
So, and there are areas with no cell phone service, so inevitably it's face-to-face.
Just a comment perhaps on a recent experience that's gonna start to take place in Brazil. So Brazil, indigenous communities in the Amazons are very difficult to reach out, right? And the measurement, national measurement of food security in Brazil hasn't taken into consideration the indigenous populations. That's one of the reasons. The other reason is that they make less than 1% of the population. And even though from an ethical perspective, you might think, well, they should do that anyways. The third reason is the language barrier. So I'm happy to share that we just learned a month ago that a national effort is being run by several Brazilian researchers to reach out to 90% of indigenous communities in Brazil. But that's something that is taking place 20 years after the first household food security measurement in Brazil. So this is not something that is only a matter of understanding how important that is or the will of doing it. It's just also a matter of resources. It's also a matter of the amount of effort that it takes and how difficult. There are regions you cannot enter if you don't have the authorization of the local authorities or communities. And there are other very complicated situations related to crime and drug dealing and so on, which makes things more complicated. So it's not security. It's security. Yeah.
Thank you. Last question, and then we'll move to Yanina.
Okay. This is Madan from Nepal, and Helvetas Nepal also adopted this SY square code to measure water security. My question is for a challenge to organize this, this study. Actually, in Nepal, what we encounter is we have a sample size of 400 households, and there are 12 questions. And for every question, there is also one option like don't know. We asked 10 questions, but for the 11th question, the respondent say don't know. So in such situation, we need to exclude that household for the analysis. Do you also have such challenges in your study?
Well, I'd like to interrupt and say there's a really great section on probes in this manual of helping people to answer when you don't know. There's also a section on how to handle when one item is missing, up to 4 items are missing. Go ahead.
I don't think we've run into a lot of problems yet in terms of needing to exclude questions or exclude households, but and Gwen could speak to this with perhaps more depth, but we may be lacking a little bit of analysis still to give a definitive answer to that, right? There may be questions where for certain communities they aren't translating well, right? So I think that's worth looking into a little further, particularly as we expand in some of these non-Spanish speaking communities.
I would just add that I think this is really like an effectiveness study. Like this is really being rolled out by local implementers and it went very well. So like the fact that you can hand this to a small NGO or a bunch of small NGOs and they all are able to get it rolling with looking, pretty reasonable data in a short period of time, I think it's really like a real world test for us. And I think in general we didn't see a lot of people refusing to respond. But of course, these are communities that have chosen to collaborate with the NGO because they want water, so they're highly motivated as well.
Thanks. Janina, can you hear us?
Good afternoon, everyone. Thank you very much for the invitation. I will presenting water insecurity in Argentina, analyzing sociodemographic influences, food insecurity, and psychological distress. We can have the next one. Well, the main motivation is that the water is a human right and it is present in the legislation of our country. And there is a lot of knowledge about the impact of the water privations, of water insecurity in the health and especially in the health of the children. Age-wise scale was an opportunity for us to measure there are a lot of different factors which are associated with the water insecurity in our country. Our objective is to examine the relationship between household water insecurity and various socio-demographic factors, food insecurity, and psychological distress in Argentina. Next one. We carry out research with a sample of almost 6,000 homes in 2023. This sample is representative of the urban population of Argentina. The next one, we can see the different indicators of age-wise scales and the prevalence in the homes of Argentina. In this case, we can see that the two first in the prevalence are the interruptions of supply and the feeling unworried. In the next one, we can see the estimation of the index of age-wise scale in the urban homes of Argentina in 6.5%, but we can see that the prevalence is higher in the case of homes with children than as homes without children. That is a point important because the children are the people who are more vulnerability to the water insecurity in Argentina. In the next one, we can see that the concentration of this problem is higher in the informal neighborhoods. In the next one, we can see that this problem increase as decrease the social stratification. In the next one, we can see that the problem is higher in the case of homes without access to network, but the problem is really important in the homes with access to the water network. In the next one, in the next slide, we can see that this problem have a association of concentration in the homes with food insecurity. And in the next, the concentration is highest in the homes with psychological distress. In the next slide, we can see when we put all these factors in a logistic regression model of water insecurity, we can see that all these factors are very important to explain the water insecurity in Argentina. It's very important the situation of the homes with food insecurity. That is one of the factors with more association. But it is important too that if you are in a very poor home neighborhood, if your home have children's and if you have problems of psychological distress in your home. It's paradoxical that the only one factor that it isn't with a significant association is the homes without connection to networks. That is a good point because we can see that there is a lot of things or the lot of factors who are best predictors of the water insecurity that the problems with infrastructure. In the next one, we can conclude that in the Argentine case, the relationship between water deprivations and social shortcoming is confirmed, along with informal neighborhood spaces, the presence of children in households, and other forms of deprivation, such as access to food and experience and psychological distress. Thank you very much.
Other questions for Janina? Maybe while we switch, can you switch to input Pablo's? Janina, I have a question for you, which is how are these data being received in Argentina? And yeah, how are they being received?
They didn't receive.
They didn't receive them. Janina, can you hear us?
Yes.
How are your findings being received? Have they been disseminated at all, and how are they being received, if so?
I don't understand you.
¿Cuál es la recepción de los resultados de tu estudio en Argentina?
Well, when we compare the prevalence of water insecurity with other problems, the prevalence is very low because we can see that in Argentina, for example, the food insecurity have a prevalence of 30% of the homes. But I think that we have to go on with this scale in the next measures of us in the next year with a different period of time of the indicators of the age-wise scale. Because we use in this case only a period of time of 4 weeks. And in our country, we have different situations along the year, and these problems of the water is more usual in the summer. For that reason, I think that we have to go on to doing this to measure this age-wise with a different period of time. We have the opportunity to present these results to the press. Yes, I don't know. And we have the opportunity to explain the determinations of the water insecurity in the urban places of our country. But we think that we have to go on working in it to take more relevance as at this scale in our country.
Thank you, Janina. Let's appreciate it.
Hi, good afternoon. I'm Pablo Gaitan. I'm at Ibero University in Mexico City. So we're going back to Mexico and again a little bit with Ensanut data, but with shifting a little bit kind of the focus of the presentation. What we were trying to do with this this part of the work we're doing, the strategy that we're implementing in Mexico, is showing how can we use the HY scales, particularly like governments, how are they taking the scale, the data, and actually using it differently besides what they're using with Ensanut data. But let me start by fighting with technology a little bit. Okay. I'm just going to focus on one state in one out of 32 states in Mexico, which is Nuevo León. So as Tere already mentioned, it's a northern state, which is the high-income states, and particularly this is an industrial state that it's bordering Texas, so it's kind of a desert climatic state. It has a population of 6 million, 92% it's urban, and it's mostly concentrated in one city, which is Monterrey, the capital of the state. And it's the third highest GDP per capita in Mexico. So it's really like this high income country in Mexico. But that doesn't mean that it's also has some aspects related to social vulnerability. 16% of the population lives in poverty. This is using the official multidimensional poverty measure. So as you can see in the map, like the darker areas are where poverty is concentrated, and it's mostly in the outskirts of the city. 23% did not have access to health services, which is part also of the multidimensional poverty measure. 12% experienced food insecurity. And in spite of being a high-income state and city, there are 154 informal settlements where especially service provision is quite poor. And 14%, using the census data, of households in Nuevo León do not have domestic water tanks to store water. So this was particularly important because they were vulnerable to shocks, on water shocks. And that's actually what happened in 2022. I'm bringing this up because this was one of the key triggers for the government to take notice of the water insecurity data. Oh, just a second.
¿Dónde está Janine? Ahí nada más le das para bajar.
Ahí más. Bájalo un poquito. Y ahí las...
Y ahí.
Okay. Thank you. Because again, this is what I wanted to show. Yeah, I mean, what you're looking at here is one of a climatic event that happened in Nuevo León. They faced a very severe drought in 2022. So what you can see in the pictures is like the kind of what they were used to have regarding water. This is one of the water reservoirs in Nuevo León, but they were facing a very important drought in 2022. This happened just as the new state government was taking office. So this was already a kind of a dry place, and it was not uncommon, but the severity and the speed of the drought lowered some of the water reservoirs in Nuevo León. So this kind of triggered the government's response, and they wanted to know much more about water and what was happening with this drought in the households. And what they realized is that they didn't have enough information to understand the impact of this drought in Nuevo León. And also, Ensanut data came up, and as you saw, like the national prevalence in Mexico was around 16%, but it was 42% in Nuevo León. So, I mean, the drought and the Ensanut data really sounded the alarms, and they wanted to do something about it. So, just a second. Now I can find that. Okay, so they started using this the Ensanut data, and they wanted like even to do things with that. So they knew that we were working on water insecurity in Mexico, and they requested some technical assistance on how can they implement water in their own instruments. So when they were facing the emergency during the drought, so they deployed this strategy, and they wanted to give all the poor households water. So this is what they were distributing. So they distributed containers, water, also water trucks. I mean, they were doing many things so they can equip water, particularly those households with did not have a tank to store water. However, when they were designing their strategy, they were worried about how to get to the poorest households and how to identify it, and they were worried about like the coverage of their strategy. So actually they have two ways to do this. One was like a general strategy, and they were using water availability measures, particularly with the Water and Sewage Office. So they knew that some places that where they can distribute water, but they were like high income, middle income, low income. They didn't care about any other variable except water availability. And they also focused on key institutions. They wanted to secure hospitals, schools, nursing homes, and shelters, that they had to, by law, they had to have water. But they also wanted to focus on low-income households, and that's what they needed extra data. They wanted, they could identify geographically, but they couldn't find the households without water. So they did their best to get there, but after this emergency, they realized that they needed some more detailed and granular water data on water insecurity, especially in the households. So after the emergency, they included the HY's scale on the Czech survey. So this survey is the instrument they use to design, fund, and allocate every social program. So this is important because they're using a different sampling strategy than the one used by Ensenut. So this is not random. So what they're doing is that they're focusing on poverty areas. So it's more of a concentration of poverty where they want to gather data. And they do it in a two-stage sampling strategy. First, they used secondary and public data to identify high poverty localities with public data. Then they collect the data in the low-income households, especially they try to cover everyone in those places, and they use the checks. So this checks has all the questions to measure the multidimensional poverty, and they added water. So now what they're doing with that is that first they're looking that in their priority municipalities, the prevalence is actually higher than the one reported in the Ensenut, and it's even higher in urban municipalities. And as expected, they're looking at, for instance, Santiago is one of the highest income municipalities in Nuevo León, but it is distributed as they were expecting based on poverty. So with this, we're still working with the Nuevo León government, and what they realize is that water insecurity should be considered in their strategy, in the social strategy, and particularly when they were using social programs. And they actually realized that urban areas were also like important, and they shouldn't be only seen as a rural problem. Also, they've been finding the WISE data to be useful for monitoring systems, so they keep gathering data. It's been gathered for a year, but they want to keep up, and they want to keep comparing sites and seeing and evaluating their own policies based on the WISE data. And it's actually two uses that they've been highlighting with the WISE data. The first is for disaster response, like the drought that we just saw. But they want to keep on using it even though the drought's over, and they want to use it for program design and targeting. And just for this audience, it's one of the lessons that we learned from that disaster is that it was important to relate water to poverty, so the social ministry could take the topic, because it wasn't related to health. I mean, even though, as we have seen, it's clearly related to health and nutrition, it was not the Ministry of Health who took the WISE data, but it was the Ministry of Social Policy. So this may be useful whenever we're looking for partners in government, that it's not only the Health Ministry who cares about water. Thank you.
Thank you. Thank you. Questions for Pablo while we do our last wrangling of slides. Hugo is our final speaker. Ask asking a really hard question. This is your big opportunity.
I guess I had a question about, like, with changing of governments or governments in general, like, do they ever get sensitive that it makes them look bad that they're not able to provide sufficient water to certain areas, or like, is that played in part? Or is it a sensitive topic?
I think it is a sensitive topic. I mean, in Nuevo León, the government was just taking office, and it was like a big emergency, and they really felt that it was a key topic to address, and actually they prefer to make a declaration of emergency, which is kind of a public acknowledgement of what was happening, and they thought that it was better to do that and address it and have all the available resources for that. And not all state governments are doing the same thing. For instance, in Mexico City, we also have a huge problem with water, but they haven't declared actually an emergency because it's not related to disaster. But in the last major campaigns, it was one of the top 3 topics being debated. So I think that water is becoming a more important political issue, and that might trigger the interest of other governments in using this data, because at least they have something to say, to report, to compare their policies with. So I think that gives momentum to the scale and the topic.
Thanks, Pablo.
Yes, Scott.
So as a researcher who's working with government, what did you learn about how to present the data, how to share the data with them so that it was compelling to people who are not researchers and don't pay a lot of attention to statistics?
Yeah, I mean, in this case in Nuevo León, it was actually the comparison, it was Census data and the comparison between the national prevalence with their state, like in the comparison kind of being like I mean, depending on the sampling, it's not representative of the state, but they had this oversampling of the...
In this case, Nuevo León State oversampling or have a state representative state.
Yes.
In this case, and in the Census of 2024. 2022
Yes.
and now they pay.
So it was important. I mean, even though Nuevo León couldn't compare to other states, they could compare themselves to other regions and to the national prevalence. So looking at that difference was quite of a shock. But also it was useful, kind of the country profiles, where you can do some comparisons by types of households, urban, rural, and I think that being able to break down that number into certain other categories was super helpful for them to actually kind of get ideas of how could they tackle water insecurity.
And last but far from least, we will bring Hugo. I'm sorry for all the technical.
Thank you very much. Thank you, Pablo. Perhaps just to follow up on your question, from my experience and from what we gathered throughout a couple of decades working on food security measurement, I do think that one of the big advantages of these kind of measures is the ability we have to send a message that is easy to understand. So we say these scales are easy to apply, easy to analyze, and easy to explain, right? And they have a construct that is clearly based on experiences related to the lack of access to, in this case, water. I'm gonna briefly refer to 2 countries and perhaps just wrap up with a regional picture. And as Sarah mentioned at the beginning of the session, we have in Brazil, I have been working in Brazil for 20 years now, and the Brazilians have this research network on food sovereignty, food security, and nutrition, Rede Pensan. They had their 6th conference about a month ago or less, in September, right? We were there, 650 Brazilian researchers who come from different kinds of experiences in research on assessment. And 20 years ago, the leadership of this Rede Pensan was in charge of validating the national food security scale. And the national food security scale in Brazil was responding to the first national anti-hunger program. Okay, so it was a call, it was a task, it was a charge from the government to academicians to find, adopt, validate, modify in whatever is needed, a food security scale that can be applied throughout the country. And this is nowadays called Escala Brasilera de Seguranza Alimentar. This BIA scale came together with other experiences throughout Latin America, and in 2007 we launched the Latin American Food Security Scale for food security, be assessed throughout the region. And those...
There's another session soon. I'm so sorry.
Oh, sorry, I can finish now.
No.
Do I have 5 minutes?
Yes.
All right, then
Please.
I'll do. Sorry for that. But, in any case, what I'm trying to say here is that this type of work and this type of partnerships we have are in charge of leading the application and further validation of the WISE scales in Brazil. And the target now is to incorporate these scales to something that perhaps in the future will look like this. And this is just a picture showing how food insecurity was tracked in Brazil starting in 2004 all the way to 2023. I forgot to add the year here. But as you can see, during the years of the national program against hunger, food insecurity in blue increased significantly. And when the political changes came and we faced the pandemic, then food insecurity basically collapsed. The last measure from 2023 puts one more time, food insecurity at a higher range in the country, and it has that this type of assessment has a huge political and policy impact, and this is why we call the redepensant to apply the HWISE in a survey they conducted in 2021 during the pandemic, showing that the scale can be applied in the country and correlates very strongly with food insecurity. In fact, in this box here, what you see here is a translation that is not a literal translation of the Portuguese message in this booklet, but they say in this picture in Portuguese, who is hungry is also thirsty, okay, because of the strong relation they found. This is a picture from our meeting in September, where colleagues from the National Institute of Statistics participated in the meeting, colleagues from the Ministry of Social Development, and those are the people who are in charge, actually, of implementing or not these type of measures. Similar situation is happening also in Colombia, right, where also HWISE is being tested, is being further validated. The language harmonization with other countries is also taking place. And I'm going to wrap up with this picture just to show you how broad and how large are the efforts on WISE measurement in Latin America. This is a list of 10 countries where studies are taking place right now under the leadership of one of our Mexican colleagues at the Autonomous University of Querétaro. And in these 10 countries, the same protocol is being followed to do a more in-depth qualitative assessment of the scale and for its further application in hopefully national service such as in Mexico, Brazil, and in Colombia sometime soon. That's what I got. Thank you very much.
Thank you all for sticking it out through that embarrassing technology. There's pins and pens up here as reward and a few more manuals. Thank you very much.
Solo tengo.